everybody. Did you know women of color continue to face significant disparities in reproductive health care, often experiencing symptoms earlier and diagnoses later? Here to discuss how that systemic bias, research gaps, and access barriers directly impact reproductive outcomes and what can be done to finally change all that, let's hope, is Dr. Marjorie Dixon. Good morning. So good to see you. Unfortunately, it's to talk about things that still need to be spoken about, but that's the only way we can hope for change.
Yep.
So let's begin with where those problems lie.
So there is definitive disparity in access to fertility care for Black women, to maternal and infant care in general for Black women. And that is something even in well-funded, developed countries like Canada. It's a problem here in Canada even. And so it's something that we need to talk about. As it said, Black women are twice as likely to have longer to get to fertility care. So even though they're seeing their physicians, they're talking about their reproductive health issues, they're less likely to be referred. Why? Because there's this bias that Black women are hyperfertile, even though that's not true. And that's been shown in studies. And Black women are less likely to be believed if they talk about pain or long periods or problems and their concerns about fertility. They'll talk to their physicians, but maybe there's less advocacy for themselves and the physicians are less likely to refer them, not purposefully, but because of that implicit or subtle bias that exists in the system.
It's a subtle, maybe even sometimes subconscious bias that somebody right now is watching before they go to work going, do I do that? And that's what we need for accountability. It starts with ourselves.
And you check yourself. I check myself every day and I'm a Black healthcare provider.
Yeah. So let's talk about some more issues. You say fibroids specifically is where there's problems. How come?
Because fibroids segregate to Black women more likely. So you're 2 to 3 times as likely to have a fibroid as a Black woman. You have more of them. They're often diagnosed sooner and more problematic, such that when you get to a fertility care, or if you come to Inova after for your fertility care, you have more hurdles to cross. So for example, we know that as you get older, your fertility drops. That's across the plane. But then for Black women, if you have fibroids as well, and it takes longer for you to see me, you've taken longer to see me, you also have an anatomical problem that needs potential surgery. Then you have to wait longer to access your surgery. And you don't know how to navigate the system. The system doesn't work for Black people. And we know that data shows that even here in Canada, the government of Ontario has actually acknowledged that it's a problem and has given us a mandate to collect race-based data.
Good. And you've always been committing to this, but you're only one person and you can only help so many. So what can be done? What can everybody do today to help?
Well, so we have to work together collaboratively as healthcare providers. Black healthcare providers, BIPOC healthcare providers, white healthcare providers, to look at collecting ethnically based data, race-based data, so that we can use that information, send it back to the government that makes the systems. So at Inova, I'm working to collect that data as I see my patients. People believe that Black women can't get to care because it's too expensive to get fertility care. We have funding. We've advocated for funding so that women can get their fertility treatments and they can be accessible to everyone and level that playing field. But we collect the data, we give it back to the people who make the rules and the regulations in government, and then we can change it systemically so that we can level the playing field so everyone, even Black women, can get to care fairly.
Because oftentimes one doesn't know what's going on with their bodies, and sometimes it requires testing or just the knowledge like you have right now to impart on people. What's the best reaction that you get from some of your patients?
It happens every day. So you know, our motto at Inova is "We see you." People say, I have to tell you, Dr. Dixon, it feels so good to have a healthcare provider who's taken the time to give me all the details. I don't take for granted that any of my patients can't understand or translate the data that I am giving them as I'm prescribing their fertility care and therapies for them. I believe that they have agency and ability and autonomy to be able to make the right decisions for themselves with my guidance. But I don't take for granted that they are less likely to have bigger problems with fertility or need less care taken for them specifically. You have to know your patients, and you have to know how health and illness segregates by ethnicity so that you can get better healthcare outcomes for your patients every single day.
Beautiful, as always. Thank you so much for inspiring us. Where do we go for more information?
At InovaFertility.com on Instagram and at Dr. Marjorie Dixon Official.
Thank you. So good to see you.
Good to see you.
We'll be back with more BT right after this, everybody.